you've been diagnosed with kidney stones. Here's what you need to know and a bit of what you might like to know. So kidney stones can take several weeks to pass, unfortunately. If you're lucky, they may pass in 1 week, but usually 2 to 3 weeks for that stone to pass all the way through. The bad news is once you get them once, you're likely to get them again in future. Maybe not for another 6 months or a year or several years, but usually once you have them once, you do end up having them recur throughout your lifetime. The good news is they don't actually harm you in most cases. Unfortunately, though, they do hurt like crazy. So people often compare kidney stones to childbirth in terms of pain. So it's extremely painful. So you want to use your pain medication that you were given. So first, let's go through the anatomy. So your kidneys are high up in your back, right up here where your ribs are, not low back, but upper back. From your kidneys, there's a tube that leads all the way to your bladder, which holds your urine. I want you to imagine this is the tube. It's called a ureter. And the stone can be stuck anywhere along this tube. And the tube is smart, and it says, we got to get that stone out. It can't stay in there. And it tries to use the muscle inside the wall of the tube to squeeze it out. And that squeezing is what causes the terrible pain of kidney stones. So there are some medications that specifically stop that squeezing. That would be ibuprofen, which is the same thing as Advil or Motrin, or naproxen, which is the same thing as Aleve. So if you've been given one of those medications or told to take them, do take them first because they will stop that squeezing pain. Start with those. If that's not getting on top of the pain, then move to the stronger medications you may have been prescribed, like Percocets or Tylenol 3s. These can make you drowsy, so don't drive or operate heavy machinery when you're taking these, and also expect that you're going to get constipated. So take whatever you have in the house for constipation if you're taking a Percocet or a Tylenol 3. Just take it at the same time. Metamucil, Docusate, something like that, whatever you've got in the house. That way you won't have the problem of constipation in addition to your kidney stones. Lastly, you may have been prescribed a third medication called Tamsulosin or Flomax. This is usually once a day for 2 weeks, and it has been shown to open up the tubes a little bit so that it can allow that stone to pass on through. It's helpful in some patients, and in other patients it doesn't really make much difference, but sometimes we give it. You may have been given a strainer as well when you left the emergency room. This is to pee into, and it's got a little mesh in the bottom, and it will catch any stones that you pee out. Now, if you can catch a stone and you don't know what kind of stones you have, you can take your stone, put it into your little urine cup here, take it off, cover it up, and then take it to the family doctor. The family doctor will send it to the lab and see what kind of stones you have. Usually these are calcium stones, but there are some other weird and wonderful stones out there, and if you have a different type of stone, the treatment may be different. So that can be helpful if you can catch a stone to pee through that strainer. The other thing to do is to stay well hydrated. Not too much. There's sort of conflicting evidence out there on how much you should be drinking, but a little more than usual. Don't get dehydrated for sure. So drink lots of fluids, but not caffeine. So tea, coffee, none of those, and no alcohol, because those fluids actually cause dehydration. They cause you to pee out more, and you don't want that. You want regular fluids, stay well hydrated, but no alcohol and no caffeine. So follow up with your family doctor within a week. If the pain hasn't completely resolved. And for reasons to come back to the emergency room, if you have a fever, 38.0 degrees if you're working in Celsius, or 100.4 if you're working in Fahrenheit or higher. If you're having burning every time you pee, not just once, but every time you go to the washroom and go pee, if you have a burning pain, that's a reason to come back to the emergency room. If you're having repeated vomiting or you stop urinating completely for more than 8 hours, so now nothing's coming out, that suggests you've gone into retention and you need to come back to the emergency room. And the reason we worry about fever and burning pain is that's a sign of an infection, and you can never have an infection at the same time as you have a stone, because if there's a stone blocking things from coming out, if there's a blockage, then the infection is just going to grow and grow. So you can't have an infection with a kidney stone at the same time. That's the reason to come back to the emergency room. I'm Dr. Atzema, and those are my discharge instructions for a kidney stone.